What up, fellas? It's Ty. Welcome back to the channel. We discuss all things prostate and prostate cancer related. If you're new here, welcome. If you've already watched the video or liked and subscribed, I appreciate you. So today we're going to talk about something that irritated me when I went for my MRI. And I think you all need to be aware of that. And that is some of these insurance companies are really playing with us in regards to these things. So when my doctor scheduler set it up, she told me, hey, luckily we have one in 2 days. I was like, awesome, I'll be there. So I get there. I'm expecting to pay my regular $40 copay. The lady says $200 and some dollars. And I was like, excuse me? She's like, yeah, your insurance company is only paying a certain portion of this and we're asking for that other portion up front. I'm like, wow. Okay. Now here I am with all of this anxiety and these thoughts and trying to figure out whether I have prostate cancer, and I'm here and hit with an unexpected cost. Now, I was able to give her my credit card and able to still get my MRI, but what if you aren't in that circumstance? What if you don't have the ability to do that? So you need to be aware that you may have to pay $100, $200, $300 when you get there just to get your MRI, and you may end up feeling like you have a decision to make, especially if you have other life things going on. So make sure that you download the app, make sure that you call your insurance company, make sure that you figure out how much this is going to cost you up front. Now here's a weird thing. My most recent MRI, I went in there expecting, I went to a different location. And I went in there expecting to pay up front. Didn't cost me anything. They took me to the back. I got it. Left out of there. 2 weeks later, I get a bill for $239. So what I'm saying to you is there are costs associated with that. And we need to start having a conversation about this, because it's my understanding that this is not part of preventive care, and I don't know what they do for active monitoring. And I'm almost glad that if they required me to do an MRI like every time for active monitoring, man, I'm not pushing anybody towards the surgery. I'm just saying that for me, I wouldn't want to pay $200. I don't know how often you'd have to do any of that, so I don't want to speak to that. But I'm just saying that if that was the case, that is crazy. That's a whole lot of money and a whole lot of things that I'd have to consider in regards to going to the doctor every time. So make sure you understand how much is this going to cost. We need to have these conversations and hold our insurance companies and just hold everyone accountable. Again, we're talking about prostate cancer here. Nobody's really talking about prostate cancer. I mean, we have this conversation and it's so hush-hush because us guys don't want to talk about it that, nobody feels like they have to do anything because we aren't talking about it. But it is a thing. We are going through it. We have a community that's going through it. And as such, I feel like these things should be covered. But again, that's just me. And I don't know. Maybe 80% of it being covered and me paying 20% is normal and that's not that big of a deal. But again, who am I to say? I'm just saying that for that individual that doesn't have it like that, that is an inconvenience. And that is a life decision inconvenience. And that shouldn't be the case. But as long as you know how much it costs, you can plan accordingly. I feel very comfortable that us as guys will make sure we're straight and we can get that done. I hope this finds you well. And as always, peace and blessings.